may need to be repeated. In this post-ECT situation, the nurse asks the client how he's feeling. The client responds by saying he's fine, but that he has a little bit of a headache. The nurse asks the client to tell her his name and the name of the place he's in. The client says his name and says he's in the hospital. The nurse tells the client he's right and that he's just finished his ECT treatment. Then she gives him some sips of water and tells him if he's able to drink some sips of water, she can give him some Tylenol for his headache. Then the nurse assists the client to sit at the edge of the bed. Education and emotional support of the client and significant others are necessary with electroconvulsive therapy. The nurse should allow the client to express feelings, myths, and fears about the treatment so that the nurse can clarify misconceptions and explain the value of the treatment. We're getting toward the end of our section on mental health, and there are a few important topics we still want to cover. The first is children and adolescents and mental health, followed by the homeless mentally ill, family violence, and then victims of crime. First, children and adolescents. They can experience mental illnesses that are also common in adults. The four most common psychiatric disorders are anxiety, depression, conduct disorder, and ADHD. Anxiety disorders in children are most prevalent during times of major transition, such as moving or changing schools. The most common sign of anxiety in children is the fear of being separated from parents and home, and refusal to attend school. Symptoms of depression in children are similar to those seen in adults, except they have irritable mood, fail to meet weight gain standards, and keep secret their depressive thoughts and crying. Depression can coincide with another disorder such as anxiety, conduct disorder, or ADHD. Attention deficit hyperactivity disorder, commonly called ADHD, is characterized by a developmentally inappropriate and persistent behavior pattern that includes inattention, impulsivity, distractibility, and excessive motor activity. The symptoms lead to problems in school and in social interactions with peers and in the family. Boys exhibit more behavioral problems, and girls are more likely to demonstrate poor academic performance. Additional behaviors of ADHD include excessive talking, fidgeting, difficulty remaining seated or quiet, frequent interruptions, and difficulty waiting. Okay, let's say you're a school nurse and a mother wants to come in and talk to you and the teacher about her 7-year-old son who has been put on Ritalin for ADHD. The mother is concerned about her son's behavior in school and at home. What symptoms would you expect the mother to describe when discussing her son's behavior at home? She'll most likely mention that he has difficulty maintaining attention with tasks, excessive motor activity. She'll describe his impaired social interactions, and she'll probably say he doesn't listen when spoken to directly, that he loses toys or other personal items and is forgetful. You could expect to hear some or all of those. Now, what behaviors would you expect the school teacher to describe? The teacher may describe the boy as having difficulty focusing attention on schoolwork, that he daydreams and is easily distracted by activity in the hall. She probably has had to move him to a front center seat because he was distracted when seated next to the window, and that he blurts out answers to questions in class and interrupts. And it could be he's leaving answers to questions on in-class assignments blank. Messy handwriting, too. I'm sure there are plenty of school nurses who have heard reports like this. And now for treatment of attention disorders. CNS stimulant and non-stimulant medications are used to control the symptoms of attention disorders. As a nurse, you'll monitor appetite, weight, and height, since this information is needed for correct dosing and periodic growth assessments for long-term therapy. Other nursing interventions for ADHD include behavioral contracts to assist the child or adolescent to gain self-control. Encourage open discussion of feelings and behavior, and provide new, more effective ways to cope and relate to others. A structured environment with limit setting and consequences of inappropriate behavior is important. What are some of the strategies for behavior management of children and adolescents? Respond warmly to positive behaviors and ignore negative behavior. Respond to behaviors in a calm tone of voice. For children, you can use timeouts that last 30 to 60 seconds for each year of a child's age. But the timeout should be non-punitive and help the child regain self-control. And that brings up a good point. How does a nurse work differently with children, since they can't communicate the same as adults do? In the first place, children tend to act out their feelings rather than talk about them. So as a nurse, you can help children communicate through play therapy, using age-appropriate toys that will promote success. Toys include blocks, a playhouse, family characters, soldiers, trucks, and other vehicles. The nurse can ask questions like, "What is this person doing? How does this little boy/girl feel?" When the play activity is done, the nurse should evaluate what the play activity communicated and what emotions and behaviors were evident by the child. Other helpful activities include art therapy for children or adolescents to describe an event or express feelings. Bibliotherapy uses books to help children identify and express feelings about aspects of their own lives. Storytelling can teach new coping skills because children don't separate imaginary experiences from real experiences, and stories can teach appropriate problem solving for real situations. And then there's adolescence. With younger adolescents, as well as children, it's best to suggest an activity to help facilitate discussion and establish a relationship. Adolescents work well with group therapy since they receive feedback better from their peers. It's good to keep in mind that silence during interactions with adolescents can be creative and productive once rapport has been established. However, be aware that silence can also be used defensively to avoid talking about feelings. Your client might not ever have learned to communicate in a positive way, so that's why suggesting an activity can help build rapport. Above all, adolescents can test nurses to see whether they'll be authority figures. The nurse should be supportive and express interest in getting to know them. Adolescents can use their anger to manipulate, and it's expressed in their lack of cooperation in the session. Adolescents often need and want limits. And remember, whether individual or group treatment is used for the adolescent, the nurse must consider the family. And now, let's review the homeless mentally ill. Individuals with mental illness account for 1/3 to 1/2 of the homeless population. As a nurse working in a homeless shelter, you'll find many clients who have mental illness such as depression and schizophrenia. What do you think can explain their lack of care for mental illness? The serious and persistent nature of mental illness, with reduced availability of government funding, has resulted in inadequate treatment and lack of resources for clients. And the numbers of homeless are growing. Risk factors for homelessness include low socioeconomic status, inability to maintain a job due to mental illness and disability, inadequate support systems, decreased access to health care services, alcohol and drug abuse, and poor compliance with prescribed medication therapy. In these cases, what would you consider the most important criterion for treatment planning or admission to the hospital? It's back to safety again. Risk of harm to self or others, which can result from mental illness or withdrawal from alcohol or other addictive substances. So what kind of assessments are important for the nurse to make? Whether the client receives services at a homeless shelter or in an emergency department, the nurse must assess the client's physical health, nutrition, mental status, and access to available community resources. What do you consider the most serious treatment complications for these homeless clients? The most serious treatment complications include cognitive deficits, nutritional deficits, physical health problems, and diseases. Inadequate support systems and difficulty bring clients into services. Harm of self or others. Victimization due to criminal activity. Untreated mental illness. Abuse of legal and illegal drugs such as alcohol, marijuana, stimulants. So how would you know if you were working with a homeless client who had a mental illness? Well, the most common signs and symptoms of homelessness include unstable residence, untreated physical and mental disorders, and self-care deficits, along with the inability to meet daily needs such as grooming and hygiene.